Imagine spending like $1 million on a massive clinical trial. You've organized the hospitals, you've secured all the ethical approvals, and finally, you get the data back to the lab.
Right, the exciting part.
Exactly. But then you realize your field workers basically asked the patients the wrong questions, or they, fundamentally misunderstood the survey tool.
Oh, man. Yeah, that's a nightmare. The entire study just collapses. And not because the science was bad, but just because the data collection was flawed.
Yeah, completely flawed. So today we are diving into the exact mechanisms that prevent biomedical research from, well, falling apart. Welcome to the deep dive. Today we are going to completely master Lecture 16, Principles of Data Collection, and this is straight from the basic course in biomedical research.
It's such a crucial topic. If you want to actually pass this exam, and, more importantly, if you want to conduct reliable research in the real world,
Yeah.
you have to understand the underlying logic here.
We are going to systematically explore all 30 multiple-choice questions provided in the source text. But we aren't just going to memorize the answers. We are going to break down the mindset of the exam creators so you understand exactly why these concepts matter.
Yeah, because the exam creators aren't just, testing your memory. They are trying to see if you can spot the common traps that ruin actual studies.
Right. And as a quick heads up for anyone following along with the original document, you might notice question 22 is just entirely missing from the text.
Yeah, it's just a ghost question.
It really is. And question 30 actually cuts off right in the middle of a sentence. But we promised a strict no hallucinations rule for this deep dive, which means we are only covering the actual complete questions provided in the text. We won't try to guess what those broken questions were supposed to say.
Exactly. We're sticking to the facts.
So let's start with the absolute foundation. Before you can collect data, you have to know what good data actually looks like. And the text hammers this home right off the bat with question 1. It asks, reliability denotes, and gives us the options. Option A, precision. B, repeatability. C, reproducibility. Or D, all of the above. And the correct answer here is D, all of the above.
Yeah, so let's break down why all three of those terms fall under the umbrella of reliability. In biomedical research, reliability is fundamentally just about consistency.
Okay, consistency.
Right. So precision is the level of detail in your consistency. Repeatability means, if the exact same researcher uses the exact same tool on the exact same patient 5 minutes later, they get the exact same number.
And then reproducibility.
Reproducibility means if a completely different researcher comes in and uses that tool, they also get that exact same number. They're all just different flavors of consistency.
That makes total sense. And the exam clearly wants to make sure you can identify this concept from multiple angles. Because question 21 asks, the ability of an instrument to produce similar results on repeated measurement is called. And your choices are A, validity, B, reliability, C, accuracy, or D, sensitivity.
And based on what we just said, the answer is obviously B, reliability.
Exactly. But then we introduce the other half of the equation in question 25, which is a true or false statement. It says, accuracy of an instrument is the ability to measure what it intends to measure. The options are simply A, true, or B, false. And the answer is A, true.
Right. So you have consistency on one hand, and then you have actually measuring the right thing on the other.
So if I'm visualizing this, is accuracy hitting the bullseye on a dartboard, whereas reliability is just hitting the exact same spot over and over, even if it's way off center?
That dartboard analogy is literally the perfect mental model for the exam. If you throw 5 darts and they all hit the top left corner in a tight little cluster, your throw is highly reliable. It's repeatable.
But it's not accurate.
Exactly, because you missed the target completely. In a clinical setting, imagine a blood pressure cuff that always reads exactly 10 points too high.
Oh, wow. Okay.
Yeah, it is incredibly reliable. It gives you the same incorrect number every single time, but it lacks accuracy because it just isn't measuring the true value. A useful data collection tool must be both.
Which perfectly explains why the source text features 2 completely identical questions to really drive this home. Question 9 and question 18 both ask, which of the following statement is or are true regarding data collection for an epidemiological study?
I love when they do this.
Right. The options given are A, reliability refers to consistency of information. B, accuracy is the ability of a measurement to be correct on an average. C, feasibility is the ability of investigator to understand the data. And then the options mix them up, like both A and B or none of the above. For both question 9 and question 18, the correct answer is that both statement A and statement B are true.
The repetition there is a massive signal from the exam writers. I mean, they want you to reflexively associate reliability with consistency and accuracy with being correct on average. If you lock those two definitions in your mind, you can navigate almost any trap they set in this section.
And they test it again in question 11. It asks, a data collection tool should be, and the options are A, valid, B, reliable, C, both A and B, or D, none. And the answer is C, both A and B.
Right, you need the tight cluster of darts, and you need them dead center in the bullseye.
But here's where they throw a real curveball. Question 23 asks, which of the following is not used as a criterion to judge the quality of data collected in a study? Now, option A was actually missing from our source document, but the remaining options are B, repeatability, C, precision, and D, external validity. The correct answer is D, external validity.
It's a very deliberate trick. They sneak in external validity to make it sound like a measure of the tool itself.
Yeah, it sounds super scientific.
It does. But remember our dartboard. Repeatability and precision evaluate the quality of your specific throws, your actual data collection instrument. External validity evaluates something entirely different.
What does it evaluate?
It asks whether the results of your entire study can be generalized to the broader population. Like, if you do a perfect, highly accurate study on 20-year-old athletes, the data is great. But it might lack external validity if you try to apply those findings to 80-year-old heart patients. It's a judgment on the study design's reach, not the quality of the data on your clipboard.
That distinction right there separates a surface-level reading from true comprehension. Okay, so we know our data needs to hit the bullseye reliably. How do we actually guarantee our field workers do that?
Well, the text emphasizes that the process begins with the question-by-question guide.
Let's look at question 15 then. All of the following are true about a question-by-question guide, except, and the options are A, it is data meant for the data collectors, B, it helps in maintaining uniformity of the data, C, it helps participants on how to respond, or D, it clarifies doubts on data collection. The correct answer, the exception is C, it helps participants on how to respond.
This is a foundational ethical and methodological rule in research. The question-by-question guide, or Q by Q, is strictly an internal instruction manual.
It's for the staff.
Exactly. It tells the researcher exactly how to phrase a question or how to interpret a vague answer to maintain uniformity. If you use it to coach the participant on how they should respond, you are introducing massive bias. You are leading the witness, which instantly destroys the validity of your data.
But it's not carved in stone, right? Which brings up question 27, a true or false statement. A data collection guidebook can be revised time to time as issues in the data collection process are identified. Options are A, true, or B, false. The answer is A, true.
Right, because once you put a tool into the real world, you might discover that, say, a specific medical term is constantly misunderstood by patients.
Right, they just don't get what you're asking.
Yeah, and if the data is coming back flawed, you have to update the guidebook so your field workers know how to clarify that specific term without leading the patient. It's a living document.
Updating the guide is one thing, but getting the staff to use it properly is another entirely. Let's hit question 5. It asks, which of the following is or are true about the training of data collection staff? The choices are A, conduct on-site training, B, conduct mock training sessions, C, training is always optional, or D, A and B. The answer is D, A and B. You need both on-site and mock training.
And question 20 approaches that exact same idea, but from the negative.
Oh, let me read that one. Question 20 asks, all the following statements are true about training of the data collectors except, and it lists options like A, essential to ensure good quality data, B, the investigators should choose the right people, C, communication skill is important for the data collectors, and D, on-site training is not essential for data collectors. The false statement, and the correct answer here is D, on-site training is not essential for data collectors.
The exam writers are heavily stressing the difference between theory and practice here. You can run mock training sessions in a quiet conference room all week. But if your team is going to be collecting data in a chaotic emergency room or, a really noisy community clinic,
they need to be ready for the chaos.
Precisely. They need on-site training to understand the physical and environmental barriers they will face. If they panic in the actual environment, your data quality just plummets.
Okay, but I want to push back on the logistics of this next one. Question 28 asks, which of the following should not be done during training of data collectors? The options are A, simulating the data collection procedure, B, discussing the study objectives with them, C, using an early version of the questionnaire for training, or D, revising the question guide according to queries. The correct answer is C, using an early version of the questionnaire for training.
Right.
But wait, In a fast-paced clinical trial where every single day costs money, why wouldn't you use an early draft just to get the training started while the final version is getting, like, committee approval?
I mean, it seems efficient, sure, but it is methodological sabotage.
Really?
Yeah,
Sabotage.
because when you conduct mock interviews, your field workers are building muscle memory. They internalize the phrasing, the skip logic, the flow of the questions.
Okay.
If you train them on a draft, you are programming the wrong script into their brain.
Oh, I see.
When you hand them the final approved version on launch day, their training will conflict with the paper right in front of them. That friction causes them to stumble, paraphrase, ask questions out of order, which completely compromises the reliability we established back in question 1.
Wow, okay. When you look at it that way, cutting corners on the tool is a total disaster. But they also need to understand the big picture, right? Question 8 gives us a true or false. There is no need to present the study and its objectives to the field investigators. Options are A, true, B, false. The answer is B, false.
Think about it. If you just hand someone a clipboard and treat them like a robot, they won't know how to handle edge cases.
Because patients don't always fit into a multiple choice box.
Exactly. A patient might give an ambiguous answer. If the investigator actually understands the ultimate goal of the study, they can ask the right neutral follow-up questions to categorize the data accurately. Context is crucial for quality.
Okay, so we have our optimized tool, our Q by Q guide, and a team train on the final version in the actual environment. Now we send them into the field. And this phase is fraught with risks. Question 3 gives a simple true or false. Supportive supervision is essential for a good data collection process. Options A, true, B, false. That is A, true.
And question 14 echoes this.
Let me check. Yes. Question 14. State whether true or false piloting a data collection tool should be done under supervision. Options A, true, B, false. Also A, true.
Supervision isn't about micromanaging, though. It's about course correction. The pilot phase is the stress test for your study. If the supervisors aren't actively watching the data collectors during the pilot, they won't catch the systemic flaws in the questionnaire or the training until it's way too late.
And I assume the biggest threat they're watching for is time, because we have 2 identical questions addressing this, question 10 and question 16. True or false? Time pressure during data collection may result in dilution of data quality. Options A, true, B, false. The answer is A, true.
Human nature is the biggest variable in research, bar none. If you assign a field worker a quota of, say, 50 patient interviews in a single shift, they will inevitably feel time pressure.
And when people rush,
They paraphrase long questions, they skip verifying demographic details, they rush the patient, they just want to get it done.
which leads directly to the darkest corner of data collection. Question 2 asks, this should not be done in data collection. The options are A, training of staff members, B, review of collected data for quality and completeness, C, manipulation of data, or D, validation. The obvious answer is C, manipulation of data.
It sounds like a total giveaway question, but it's linked directly to the time pressure we just discussed. Data manipulation doesn't always mean a sinister plot by a lead scientist in a dark room.
Right, it's not always malicious.
Most of the time, it happens when an exhausted field worker, under severe time pressure, decides to just guess a patient's missing blood pressure reading instead of walking all the way back down the hall to check the chart.
Oh, wow.
Yeah. That is data manipulation, and it destroys clinical trials. That is exactly why supportive supervision is necessary to alleviate that pressure before it leads to bad choices.
Okay, pay close attention to the phrasing of question 13 because it's a classic exam trap. It asks, which of the following should not be done in relation to data collection?
The key word being not.
Right. So option A is training of staff members. Option B is review of collected data for quality and completeness. Option C is validation, and option D is none of the above. The answer is D, none of the above.
Because the exam writers want to see if you are actively reading or just panic scanning for familiar terms. Training, review, and validation are all mandatory steps.
Right, you definitely want to do those.
Yeah. Therefore, the answer to what you should not do is none of them. You have to slow down on the negative phrasing in these exams.
And wrapping up the execution phase, we have question 24. Which of the following should not be done during data collection in a study? The options are A, referring to the data collection guide, B, checking the quality of data, C, modifying the study objectives, or D, validating the data collection process. The answer is C, modifying the study objectives.
You cannot change the finish line while the race is running. modifying the objectives mid-study invalidates the entire planning phase, the Q-by-Q guide, and the specific training you just spent weeks completing.
It's basically a whole new study at that point.
Exactly. If the scientific objectives change, the entire study protocol has to be rewritten from scratch.
All right, so the field workers have finished their interviews for the day. The clipboards are full. But before anyone leaves the hospital or the clinic, a crucial review process has to happen. Let's look at question 19. Who is mainly responsible to check the accuracy of data collection instruments before leaving the location? Options are A, field investigator, B, field supervisor, C, principal investigator, or D, study participant. The correct answer is B, field supervisor.
Right, the principal investigator is likely back at a university laboratory, so they aren't even on site. The field investigator is the one conducting the interviews. They're way too close to the material to effectively audit their own work in real time.
So the supervisor is the final gatekeeper.
Precisely. Before the team gets in the van to leave, the supervisor must review the forms.
And what exactly are they looking for? Well, question 4 tells us. The collected data should be, options are A, complete, B, readable, C, consistent, or D, all of the above. The answer is D, all of the above. And we see this applied to a specific scenario in question 12.
Oh, the neurosurgeon one.
Yep. Question 12 says, a neurosurgeon is planning for a hospital-based study on the patients coming to the emergency department with head injury. The collected data should be, and the options are, A, complete, B, readable, C, consistent, or D, all of the above. The answer is, again, D, all of the above. I kind of think of this like checking your receipt before you leave the grocery store.
That's a really great way to conceptualize it. If you get all the way home and realize an item is missing from the bag, it's too late to fix it easily. In the context of the neurosurgeon in question 12, an emergency department is chaotic. If a form is incomplete, the supervisor needs to catch it while the patient is still right there in the triage bay.
And readability.
Readability matters, because if the handwriting is illegible, the data entry team back at the lab will just guess, which introduces errors. And consistency means checking for logical impossibilities. Like, if a form says a patient is 12 years old, but also lists their occupation as a retired mechanic,
That's a problem.
that is a major inconsistency. The supervisor has to spot that while they can still ask the field investigator what went wrong.
That makes the trap in question 29 very, very clear. It asks, which of the following does not apply in checking the quality of filled forms during data collection? The options are A, completeness, B, consistency, C, readability, or D, statistical significance. The correct answer is D, statistical significance.
It's absurd, right? The idea of a field supervisor calculating p-values and running complex regression models while standing in a busy ER hallway holding a stack of paper.
Just doing advanced math on the back of an envelope.
Exactly. Statistical significance is determined months later during data analysis. In the field, you only care about the mechanical quality of the data. Is it complete, readable, and consistent?
So when the supervisor inevitably finds messy handwriting or inconsistent answers, what's the protocol? Question 7 asks, appropriate means to troubleshoot the difficulties in data collection process. The choices are A, regular review meetings, B, facilitate the discussion to identify issues during the review, C, clarify the issues experienced by staff during data collection, or D, all of the above. The answer is D, all of the above.
This is the debriefing phase. You don't just fix the single form and move on. You hold a review meeting with the whole team.
Because if one person made the mistake,
Others probably did too. If one investigator misunderstood how to record a patient's medical history, you facilitate a discussion, identify the root cause, clarify the protocol, and if necessary, you update that Q-by-Q guide we talked about earlier.
awesome. We have finally arrived at the last step of the data collection process, which is validation. Question 6 and question 17 are identical and ask, which one of the following is the proper way of validating the data? The options are A, repetition of full data collection in the same population, B, data collection in new population, C, repetition of data collection in a randomly selected subset in the same population, or D, repeat data collection is not required. The answer is C, repetition of data collection in a randomly selected subset in the same population.
Think of validation as an audit. You have to prove that your field investigators actually did the work and didn't just sit in a coffee shop checking boxes to meet their quota.
But you can't redo the whole study.
Right. Repeating the entire study doubles your budget and your timeline, which is impossible. So a supervisor takes a small, random subset of the completed forms, tracks down those specific patients, and asks them a few key questions again. If the patient's answers match the form, the investigator's work is validated. It's exactly like a factory pulling every 100th widget off the assembly line to check for defects.
Which brings us to the ultimate synthesis of everything we've discussed today. Question 26 asks you to arrange the sequence of steps. Which of the following is the correct sequence of steps of data collection? 4. Preparation of data collection guide. 2. Checking the collected data for completeness. 3. Training of the data collector. 4. Validating the collected data. The options give you various scrambled combinations, but the correct answer is option C, which is Roman numeral I, then 3, then 2, then 4.
If you understand the narrative we've been building this whole time, this is completely intuitive. You cannot train a team until you have a guide. So preparation of the guide comes first.
Then training.
Then you train the data collectors using that exact guide. Once they are trained, they go into the field to collect data, and the supervisor checks it for completeness on site. Finally, after the data is collected, you perform your random subset validation to prove it's authentic. It is a logical, chronological flow.
And there it is. You haven't just reviewed the multiple choice questions for Lecture 16, you've totally dismantled the logic behind them. You understand the traps, the practical realities of field work, and exactly what the exam creators are looking for. You are entirely ready to walk into that exam and absolutely dominate the section.
But before you close your notes, consider how these principles apply to the data you consume every single day.
Oh, that's a good point.
Yeah, look at the health apps on your phone, tracking your steps, your sleep, or your heart rate. Ask yourself, are those sensors truly reliable, giving you consistent readings regardless of the conditions? Or are they actually accurate, measuring your true biological baseline?
Because we know those are two very different things now.
Exactly. Whenever you are presented with a chart, a statistic, or a dashboard, don't just blindly accept the numbers. Ask yourself, what was the step-by-step process used to collect this data? And who is the supervisor checking the instruments before that data was presented to you as absolute fact?